Monday, the federal government updated childhood vaccination schedules. In the recommendation, they omit universal recommendations for RSV, flu, COVID, hepatitis, and more vaccines. Many people in the healthcare industry are pushing back against these changes. I spoke with the state's top doctor and a West Michigan pediatrician about how they're handling these changes.
This is going to create a lot of confusion for people.
Dr. Natasha Bagdasarian, Michigan's chief medical officer, is responding to changes by the CDC, no longer recommending universal vaccines for RSV, flu, COVID, hepatitis, and more for children.
I am dismayed that we're not following the science and the data that has well established the safety and efficacy of these vaccines.
The Michigan Department of Health and Human Services is pushing back against the CDC's changes. Dr. Bagdasarian said they continue to follow recommended immunization schedules created by the American Academy of Pediatrics and the American Academy of Family Physicians.
The vaccine schedule has been changed without presenting any data, without presenting any sort of reasoning behind these changes. And I do fear that this will further undermine trust in vaccines.
She says not only are the changes creating confusion among parents and caregivers, but for healthcare providers too.
Putting them in a difficult position right now where the federal government is recommending something that is not in line with their national scientific bodies and with their national peers.
And so I'm seeing a lot of parents come in with that skepticism, asking, is this safe? Are these effective, etc.?
That's Dr. Braden Eggstrom, a pediatrician at U of M Health West. He is also following AAP recommendations for childhood vaccination schedules.
My fear is that it's going to cause more parents to be more skeptical about vaccines, more hesitant, and miss the appropriate windows where we need to get the kids vaccinated to give them that lifelong protection.
He says it's natural to have questions about vaccinations with so much noise surrounding the topic lately. So have a conversation with your child's pediatrician about what's best for your kid.
We all want your child to be healthy, prosperous, and do all the things they want to do in life, right? That's why we get into pediatrics, is to help kids grow up. And we're all on the same team with parents.
The CDC now splits vaccines into 3 categories: vaccines for all children, vaccines for certain high-risk groups, and vaccines based on shared clinical decision-making. It says the changes will not affect health insurance coverage of vaccines.